Alright, the first test we're going to do is the posterior sag sign. And for this one, I'm going to have my patient sitting supine, and I'm going to have her hip flexed to 45 degrees and her knee flexed to 90. And all I'm going to do is look for a backward shift in the tibia. And if there is a posterior shift of the tibia on the femur, that could indicate a PCL injury. But that backwards displacement could also indicate injury to the arcuate ligament or also the posterior oblique ligament. So next test is the Godfrey 90-90. For this one, I'm going to have my patient supine. I'm going to have her lay down for this one. And I'm going to have her knees flexed to 90 and also her knees and hips flexed to 90. And I'm going to stabilize her feet. And for this one, I'm just going to look for a posterior displacement of the tibia again. And for this one, if there is that backward shift, that would indicate a PCL injury again. Next one we're going to do is the posterior drawer. Can you scoop down this way a little bit? Okay. And then for this one, I'm going to have my patient sitting supine again. And I'm going to have her injured knee flexed to 90, and I need to stabilize the foot for this one, so I'm going to go ahead and sit on it, and I'm going to hold the proximal end of the tibia, and I'm going to apply a posterior force on that tibia, and if there is no end point or if there is a significant backward shift of the tibia, that would indicate a torn PCL. Next test we're going to do is the valgus stress test. And for this one, I'm going to have my patient sitting supine with her quads and hamstrings relaxed. And for this one, I'm going to hold the medial part of the distal tibia and then also the lateral joint line of her knee. And I'm going to apply a valgus force on that joint line, on the lateral joint line with her knee at full extension. And I will also apply that valgus force with her knee at 30 degrees of flexion. And if there is opening in that joint line with the knee at full extension, that could indicate injury to the MCL and PCL. But if there is opening in the joint line at 30 degrees of flexion, that could indicate injury to the MCL. So last test we're going to do is the varus stress test, and varus stress test is the complete opposite of the valgus one. I'm going to have my patient sitting supine again with her quads and hamstrings relaxed, and I'm going to hold the lateral part of the distal tibia in one hand and then the medial part of the joint line of the knee in my other hand, and I'm going to apply a varus force on the medial joint line with the knee at full extension. And then I'm also going to do the same thing with the knee at 30 degrees of flexion. And so if there's any opening in the joint line with the knee at full extension, that could indicate injury to the LCL, PCL, and also the arcuate ligament. But if there is opening in the joint line when the knee is flexed at 30, that could indicate damage to the LCL.